looked at these renal patients is that a previous study that we published actually at the beginning of the year, but it was a much smaller study. It was the PUNCH CD3, which was the pivotal study, much smaller database. That's where we recognized these sort of changes. And interestingly, the patients with renal disease in that group showed very, very similar results to this study. So there is a consistency there. The difference between the two groups is not statistically significant. As you say, 66 versus 77%. So I think, you know, the explanation I've just given about renal patients having a disturbed microbiome may contribute to this slightly lower efficacy rate. But still, it is if you think 2/3 of your patients with renal disease are going to succeed with recurrent C. diff. So I think the adverse events, it's a noticeable difference for sure. These events, though, were generally not felt to be truly associated with the therapy, and that moderate to severe is quite a broad definition, and that none of these particular events were related to Rebyota administration. And in fact, the majority were related to pre-existing conditions. So if you think about this patient population, they've already got an adverse event burden. So this really is probably exemplified in this particular situation of having C. diff and, you know, fairly complex renal conditions. Many of them had elevated Renal Comorbidities scores as well, which just goes towards the underlying problems and complexity of these patients.